And it wasn't until around 2007, 2008, if you will, somewhere around there, that my son ended up in the emergency room. And that was the beginning of really, wow, I connected the dots as to where the problem was. What I did for me is I sought out the information from the people that really were the pioneers. So for me, I really researched it and I read the literature and I went there, and it was, honestly, much of it was outside of dentistry.
I'm Mark Cruz. I'm an airway-focused dentist that advocates for wellness. My mission is to help you transition from disease management towards true wellness, starting with your airway. When your airway is limited in any way, it affects your sleep, your health, even your smile. We treat root cause, not just the symptoms, so that you wake up refreshed, live fully, and smile freely. Visit our website, markacruzgds.com. Breathe, sleep, and be well.
Welcome to another episode of our podcast, Breathe, Sleep, and Smile, formerly known as Breathe, Sleep, and Be Well. I'm excited for another podcast. Amber, what are we going to talk about today?
We're going to talk about the signs nobody recognizes, and that is your airway costing you your health? So most people with an airway problem, they don't know they have one. They think that they're just tired, they're anxious, they're grinding their teeth, they can't focus. They just think that that's just a normal way of living. So they go about their life.
Yeah, I'll argue that it's so prevalent in our society. And you know what? The data is pretty clear about that in particular. Especially, high functioning, young to middle aged, the cohort in our population, that they're kind of in the prime of their lives and they're able to overcome a lot, but they're not maybe functioning optimally. Right. And yet when you start drilling down and asking them questions, I mean, they may come in and say, I get these headaches, or I've got some joint pain, or I'm grinding my teeth, or I don't like my smile. That you delve a little deeper and you find out that there's a lot that's maybe going on there that was not recognized because it's so common and it would be considered normal. Like, oh yeah, I wear my night guard. That's what I was told. Mm-hmm. It never changes the fact that you're still grinding. It just mitigates the effect, the adverse effect on the dentition of that. But what we see are symptoms really related to the autonomic nervous system. So the autonomic nervous system has two branches. It's the fight or flight, we call that the sympathetic, and the parasympathetic, which is labeled as rest and digest, meaning those normal functions are optimized. They happen easily. You digest well, no gastric upset or reflux, and you're thinking well, you're even keel in your moods and everything. Oftentimes, those individuals suffer from physiologic stress that manifests in what are called functional somatic symptoms, or the functional somatic profile that's related to the autonomic nervous system that's trying to solve a problem. Anxiety, you may think that it's the traffic or a deadline that you're missing. Maybe, but that's conflating psychological anxiety with physiologic anxiety. So, as an airway-focused dentist, you kind of parse those out with your examination to understand what's what. You're not saying it's one or the other, maybe both, but you want to kind of find out how much of it is from the things that we can resolve clinically, and so you need to know whether it's physiologic or psychological. So there's that. Depression is highly correlated to poor quality sleep and sleep fragmentation. It's not a lack of Paxil, or any of the SSRIs or that a lot of people are on that look perfectly healthy, but they just tend to be a little blue, right? And you wouldn't know it. Yeah. Because, who's going to broadcast that? Yeah, I'm on an SSRI, right? Or you have digestive problems that get mislabeled as, gut issues because you don't have the right flora. Yeah, the biome in your gut is super important, no doubt about it. Gut flora, starts really from the oral cavity all the way throughout, and certainly we'd be healthier by eating more fermentable foods, prebiotic, probiotics. It helps with our digestion, but oftentimes we also miss the fact that you have the small intestine spasming due to low end-tidal CO2. The way you're ventilating causes the smooth muscles to spasm, so that can create some problems. That's just another example. And so these are all very common symptoms that are treated in our healthcare system, either with medications. Reflux is another one. Effortful breathing at night can pump the stomach and cause laryngeal-pharyngeal reflux, or what's called respiratory reflux that gets misdiagnosed as asthma. It's allergies, it's the season, but it's actually the pepsin that got atomized to go up the airway tube that doesn't belong there, and it goes into the nasal fossa. It actually can also be in the eustachian tube. There's a term in the otolaryngology or ENT literature called glue, where they can actually culture pepsin in the ear tube, right? It doesn't belong there, and yet it's so nuanced. So there are a lot of these things that tend to be glossed over, or we don't quite understand, that are, I say, the little canaries in the gold mine, and you start finding out they have one. Yeah. There may be multiple ones, and yet these healthy individuals find that maybe supplementing helps, maybe changing their diet a little bit, exercising a little bit more. They're in control of it, and then they're now using Fitbits and wearables, and they really want to figure out what it is. And maybe it helps, because the body does want to heal. Yeah. If you give the body just a little bit of a chance, it will heal. It'll become subclinical, and therefore you think, oh, that supplement, I'm going to talk about it. It's what took care of the problem. It just made you subclinical. There may be other things that are going on. So I think we need to have a more comprehensive awareness of what's going on in any given individual, not any one symptom, if you will. It's usually multiple things from all the organ systems.
I mean, I feel like we can go so deep into this conversation on so many topics, and I think a lot of people just live with those underlying issues, thinking that it's just a way of life. Kids are the most under-identified group. That's what we feel. What does an airway problem look like in a child, and what actually happens if that doesn't get caught early?
Oh gosh, I mean, it could start from when you're born and they're colicky. Right. They can't latch. So colicky baby is one that can't get a good seal and nurse, and so they're sucking in a lot of air, and that causes distension of the esophagus and the stomach, and they become colicky, right? They really complain a lot, and they burp up. They might have reflux. So it could start as early as that, and then of course at around 3 and 6 months, the risk of SIDS. That while the larynx descends at about 3-4 months of age to be able to prepare our airway for language. That's a whole process we're not going to get into. That makes them more vulnerable as well, where maybe choking, bedwetting, recurrent earaches. In most states, the pediatrician will medicate 5 to 7 courses of antibiotics if they have these recurrent earaches, and then tubes, right? To the tune of 500,000 tubes a year. That again is putting makeup, I'll argue, putting makeup on the melanoma. It's really not asking why, because most of those kids, most of them, clearly the evidence is clear, and yet it's just mind-boggling that even though the evidence is out there, it's not treated that way. I understand our allopathic disease management healthcare system has its way of thinking. It's a narrow palate. You just expand that palate, and it allows for the 3 small muscles that gives function to the eustachian tube to function properly. And that's also been well documented. And so tubes is just kind of a workaround that problem. Conductive hearing loss. Right. You may not even know that your child has conductive hearing loss. I mean, does a pediatrician routinely go ahead and do audiology on an annual basis on our kids? Yeah. Maybe if they're at school and they're not doing so well, we may find out that they have conductive hearing loss. They can't hear the teacher as well, and they don't have the attention span as a result. So these are some things that we start looking at. They're perfectly normal, except there's an issue with growth and development, again, starting through the birth process. So I'll take a very comprehensive birth history on them. You know, how many weeks were they in the NICU? Was Pitocin used? We can kind of go down all those things. And then let's say they're LTS, less than 6, they're 4 or 5 years old. What are their symptoms? When they wake up in the morning, are they cranky? Is their bed really messy? I call it a hurricane bed. So I ask mom to take a video or two of their baby when they're sleeping. You see they're flip-flopping and they're sweaty. They're getting up, they're waking mom up all the time. They have night terrors or the parasomnias, are walking in their sleep. Those are all telltale signs. And then they get older and now they've got dental crowding. And so then they go to the orthodontist to straighten out the teeth. The problem isn't a dental problem. It's not a tooth problem. It's a problem of facial growth, and of which the teeth alignment is the least important. Right. The more important thing when you start delving down, and you do as an airway-focused dentist, is asking those questions. It's a breathing and sleep problem. It's the cognitive problems. It's the mood problems. They're not regulating metabolically. Maybe they're a little bit overweight for their age. Is it really the Pop-Tarts that they're eating that their brain wants because they want the glucose, right, because they're in sympathetic drive? I mean, we could talk a lot about all those things. Yeah. But in our healthcare system, that's just the way we're treating them. Yeah. And then industry with the food industry is just really feeding into that. And so they're not functioning, as I say, as an optimal mammal. Right. So a mammal is super efficient in energy consumption because they're in parasympathetic coherence 90% of the time. As Robert Sapolsky, the well-known neuroendocrinologist that wrote the book Why Zebras Don't Get Ulcers, he talks about how the zebra that gets chased by the lion once a month, as soon as it knows it's outran the zebra, it turns back and it doesn't continue running. Its head goes down into the grass and starts eating again because it needs that energy. Right. And so that's an efficient mammal. Its survival depends on it. And so it's a little bit of that is really us understanding these very, very basic principles that, I hate to say it, our disease management healthcare system hasn't helped. And don't get me wrong, our allopathic system has done miraculous discoveries and helped our society in many regards, but I will argue that a GLP-1 should not be the first intervention in trying to lose weight. It might be convenient, you can continue to live your lifestyle, but there are side effects, and they're relatively new. We don't know how many of them, and now everyone's competing with the different versions of it, and we're finding out they have other side effects that may be beneficial. Maybe I drink less alcohol because of this GLP-1, so that's a benefit. Let's just kind of step back a little bit and say, how is the human body supposed to function optimally, and not base it on what's common, right, which is a sick society. In the United States, we're not even in the top 50 population health. Let's look to what other blue zones are doing for health and wellness, and then maybe change the way we see the patient. So I'll leave you with that.
I mean, this is fantastic. I love going down these conversations because I think a lot of people are just really open to wanting to learn more, to understand what's best. Even when you just mentioned about ear tubes, you would never think to go down the route of checking their airway and checking their breathing. You just listen to what the doctor says and you go and you get ear tubes, right?
I'll just say, yeah, thank you for saying. Well, that's what our curriculum is all about, is really understanding the physiology, understanding growth and development, understanding how things are supposed to happen, and what are the things that happen along the way when they're not, that are markers, right, that we can reverse. The earlier you catch it, the less expensive it is, not only financially, but biologically. Right. And that's really what I'm held to for myself and for my colleagues, is really not to wait to where you're doing an intervention that's expensive, that really doesn't even fix the problem completely. Yeah. And I think that's what we should be doing for our population. And I think they would be very open to it. if we do it, but that's just not the way we're trained. So,
Right.
yeah, thank you for saying that.
Yeah, yeah, absolutely. I mean, was there a patient or a moment in your practice that changed how you looked at the connection between airway and systematic health?
Oh, gosh, yeah.
Or many?
My son, is going to be 22 next month, in a couple months. But when he was 6 years of age, I had already been teaching courses in airway on adults. My practice was limited just to adults. I was
Right.
kind of focused on complex restorative prosthodontic interventions. That was my background, and I was always unsettled with certain concepts having to do with what we call occlusion that just didn't answer or make sense, and there were different schools of thought, and I was a little bit of a maverick in that, but I kind of figured some things out, and adding the concept of airway and myofunction. It wasn't just structure, it was also function. And it wasn't until around 2008, 2007, 2008, if you will, somewhere around there, that my son ended up in the emergency room. And that was the beginning of really, wow, I connected the dots as to where the problem was. And what I did for me is I sought out the information from the people that really were the pioneers. So for me, I really researched and I read the literature and I went there, and it was, honestly, much of it was outside of dentistry. In fact, then I started what we now call a podcast. Then it was called a Spreecast, even before Zoom came around. And my partner and I started interviewing colleagues from all over the world, from all kinds of different disciplines on this. And what I started seeing is this mosaic, and everyone had different points of view on the same problem. Let's call it the elephant, where one was looking at the tusk, one was looking at the leg, one was looking at the tail. The parable about that Godfrey talked about back in, I think, the 1940s or whatever, that they're all blinded but looking at just one section of it. And to me, that was like, wow, that was it. I need to really start looking at things more globally and understanding with a lot of humility that I knew very little. And that anytime you start making yourself the authority and where the ego creeps in, that's when I know that person doesn't know that much.
Yeah.
The smartest people in the world are the ones that know the most and that are more open to understanding. Yeah. And those that are dogmatic, and that's the way it is, they can't think about it. And that hurts patients. Yeah. That's hurt our population. I have many arrows in my back in the beginning from doing that. And now I'm a grown man, I could deal with that, but the point is I started learning from the osteopath, from the myofunctional therapist, from the ENT, from the pulmonologist, from all these different disciplines, and that was really the beginning of my journey in connecting those dots of where it started with my son, 2007, 2008. I mean, that's almost coming on 20 years, and at the time, people thought I was crazy about that. And I could tell you stories about some of those arrows that sunk in deep that really threatened and was very disruptive to my local community and other communities that didn't want to hear it. And so I'm very grateful that we are now we're full of many airway experts.
Yeah. Yes.
Everyone's an expert now, right? Whereas the ones that were throwing the arrows now, they're the experts. And that's okay, because that's natural human behavior. Yeah. Thomas Kuhn wrote a book called The Structure of Scientific Revolution, and he talks about any disruptive technology. This is natural. Florence Nightingale, Ingar, Semmelweis, there are all these actually dedicated chapter in my textbook about just this thinking, and you kind of get normal and understand that because you, as a provider, will also deal with that with your own patients and your own colleagues. Right. So this, again, is part of what this podcast is about, and I'm excited about having you helped me with that. So thank you.
Oh,
Yes.
absolutely. I'm enjoying it, and I'm learning so much along the way, so it's fantastic.
Yeah.
If someone was listening right now and they suspect that they or their child might have an airway issue, what would be their first step, and what would they do?
Well, I think I always say start educating yourself about it, and that's how I get now. Maybe a third of my practice is from out of state. They come in. I tried to find somebody that really understood, or I went there, and I heard about you, and they came in. And let me just make it clear: this podcast is not about me bringing patients into my practice. I'm very busy.
Yeah.
I'm bringing on partners, and I moved into a new facility to try to really scale that. My main goal is really to get all of dentistry and healthcare involved in that. But having said that, I think is educate yourself and then call a provider that you feel is airway focused to actually ask the right questions and get enough data. It should be data-driven, evidence-based, data-driven, and understanding what to do, as I keep on saying, measure twice, cut once. So that's what I would say. I have an app right now. I'll just end with that one of my patients who's an engineer who happened to, I treated both his kids, and he's now looking at being treated, and he started, as I say to all my patients, the first step is really educating yourself. Go on my website. I've got a bunch of videos, and by the way, they're not just of me. They're of many, many different people, just to get that perspective, because I always think that the patient will make the best decision when they're educated. So I always foster that, and I'm emotionally detached from the relationship of a patient wanting treatment or not with me. Doesn't matter. Just do the right thing by yourself. But he started looking at some of that information. He said it was so fascinating. He said, I have to drop all my projects in this firm that he's in, and I spent the last 3 days just taking a deep dive on the stuff that you were talking about, some of my podcasts. And then he created an AI agent that has a QR code that does not scrape the internet. It's just so it won't hallucinate, and it gets just the evidence-based data on it. And so I'm excited about that, because I think that's a lot of the future is in AI, getting really, really good data that is not distorted based on a lot of the misinformation that's out there. Yeah. But to answer your question, summarize it succinctly is just get information, educate yourself. And I have found the mama bears, if you will, they have a sense of what's right and what's wrong. And many of them will complain about how they're just not satisfied with the answers that they're getting from their pediatrician. Maybe for themselves they'll put up with it, but when it's their own DNA, they're going to really take care of that. And I think kudos to them. Yeah. And that's really a lot of what started the MAHA movement, which I think it's great. So there's this big grassroots that I'm very excited about, and really taking more control of our own health. And we've talked about that in other podcasts. So thanks for asking that question. It's a really good question.
Yeah, and I think on another upcoming episode that we do, we should really dive in to children and how they're affected, and the steps that you can take, or even the signs to look for in your kids. And maybe in that episode, we'll just break it down into different age categories, because you talked about right from a newborn being colic, right up to being a toddler, then to being an early teen. So we'll bring that to the listeners in the next one.
Let's do that. I call that the Airway timeline.
Yeah.
And there are epics, if you will, from cradle to grave. We start when we're born with that first inhalation.
Right.
That's how we start life. It's that wah when you get spanked, and you end with the last exhalation, which is at the time that your family comes together to celebrate your life. And in between, we'll call that the dash, there's a timeline. And growth and development, adolescence, adult, and then you start getting into more of the geriatric population. I think that's a really good idea. Let's talk about it. And maybe it will take more than one episode, but I look forward to that. It just might. So thank you very much. I
Thanks,
appreciate
Dr.
it.
Cruz.
Yeah, it's my pleasure.
Thank you, guys.
It's my pleasure. Thanks.